Now let me help you understand what we mean when we talk about risk factors. These are the indicators we use to assess your 10-year likelihood of having a heart attack or dying from one. Each of these risk factors count towards your overall cardiovascular health, and the greatest benefit will be obtained if you work on reducing all your risk factors. Let's go back to our example of Joe. He is 50 years old, his total cholesterol is 240, his good cholesterol or HDL is 35, blood pressure is 140/80, and he smokes. If we plug these numbers into a simple risk calculator, we can say that his 10-year risk or likelihood of having a heart attack or dying from one is close to 30%. That's roughly 1 in 3. Let's say that we work to bring Joe's blood pressure down from 140/80 to 120/80. That lowers his 10-year risk from 30% down to 24%. If we were to bring Joe's total cholesterol down from 240 to 190 and bring his good cholesterol up from 35 to 45, then his 10-year risk would come down from 30% to 16%. And if Joe were to quit smoking, his 10-year risk would come down from 30% to 13%. But what if Joe were to decide to do everything he could to be healthy, and he addressed all 3 of these risk factors? He quit smoking, he reduced his blood pressure and cholesterol. His 10-year risk would go down to 5%. So we are down from a 1 in 3 likelihood to a 1 in 20. That is what you can do for your odds if you will make the decision to do everything you can to live healthier. Remember that living healthy does not just reduce your risk of dying from heart disease, it also improves your quality and length of life, which is something we all treasure.